ones that are not infectious. This means they can't be transmitted from one person to another.
These diseases cause 71% of deaths globally, which far outweighs the number of deaths caused by communicable diseases at just 29%. Non-communicable diseases affect the individual, their family which is supporting them, and their country. Countries spend huge amounts of money trying to treat ill people. And not only that, it affects the global economy because people who are ill aren't able to contribute to the workforce.
What's crazy about these illnesses is that most of them are preventable, as most of them are caused by unhealthy lifestyle choices and environmental factors.
I smoke and I like it.
I like to drink beer in the evening. I can do it every day.
Walking, sport, I work in the office. I'm always pressed for time.
I adore soda, sweeties, chips, and hamburgers.
Smoking, alcohol abuse, lack of physical activity, unhealthy eating, lead to emerging of non-communicable diseases, cardiovascular and oncological diseases, diabetes, and chronic respiratory diseases.
There are 6 proven causal mechanisms that you need to know. The first is cardiovascular disease, which has the risk factors of diet, smoking, and exercise. A poor diet can increase the levels of blood cholesterol. Smoking can increase the blood pressure and damage the lining of the arteries. And a lack of exercise can lead to a buildup of fatty deposits in the arteries.
Type 2 diabetes can be caused by obesity. The result of this is the body stops responding to an increase in blood glucose levels, which is dangerous. Liver and brain damage are both caused by alcohol. This can cause liver cancer and cirrhosis, which is scarring of the liver. It can also cause brain damage, which stops the brain to functioning properly even when sober. Lung disease and cancer are both caused by smoking. Tar is a carcinogen and it turns the lungs gray and increases the risk of lung cancer. Damage to the fetus is caused by both smoking and alcohol. The result of this can be a low birth weight, a premature birth, or even a stillbirth. Cancer is the uncontrolled cell division. It can be caused by carcinogens in a person's environment, including ionizing radiation like UV light from the sun and radioactive metals like uranium. Another cause of non-communicable diseases involves environmental factors like pollution. Chemical contaminants in air, soil, or water can find their way into our bodies through inhalation, absorption through the skin, or consumption of contaminated food or water. Repeated exposure to chemical contaminants can cause illnesses like chronic obstructive pulmonary disease or COPD, lower respiratory infections, gastric issues like diarrhea, disruption of the endocrine system, which controls hormones, skin rashes, birth defects, and a host of different cancers. Environmental factors can also serve as triggers for other diseases like asthma, psoriasis, or herpes. Given these facts, how can we prevent these non-communicable diseases? To prevent these non-communicable diseases, we need to quit smoking, to move actively for at least 30 minutes a day, we need to stop abusing alcohol, and to eat 5 portions of fruits and vegetables and reduce consumption of sugar and salt. On the other hand, there are some non-communicable diseases that are caused by age and genetics which are simply out of our control. But can we do something about them?
For the illnesses that you can prevent, regular medical checkups and medical screenings can help detect them early so that treatment can begin right away.
How about those risk factors in the environment that can cause non-communicable diseases? We can work together to improve our world. Simple measures can be taken immediately to protect our health and the environment. We can reduce our consumption and clear our air by using sustainable fuels and walking or cycling more. We can safely store toxic substances in our homes and workplaces. We can protect our water resources by disposing of waste appropriately and introduce clean energy technologies. We can bring multiple government sectors together to ensure all policies actively support health. Let us all work together to improve our health and well-being.